So I really rambled on a lot longer than I wanted to in that last video, and I didn't get to really talk about the question you asked about the legitimacy of using psychology on YouTube to sort of diagnose others. And I think definitely in the context of an argument, bringing in a psychological analysis to save face isn't really um, a valid use because it's very difficult to remain objective in that case. But in most other cases, I think YouTube is a great format for psychological, um, maybe not diagnosis, but analysis at least, because I don't see it as a detriment that we don't know the people who make videos that we watch personally. Um, I think that's a benefit because it provides us the opportunity to take an objective look. If we are personally friendly with somebody, it's almost impossible to make a legitimate psychological diagnosis or analysis of that person because our psyches are both so intertwined and related that it's impossible for me as the person's friend to step outside of our relationship and make some objective statement about the health of their psychological um, being. But when we are able to maintain distance, such as the distance that video allows, I think it's a lot easier to see the situation from outside, to see the person's state of being from outside. Um, and definitely, when you're talking about a psychoanalyst, they have been professionally trained and they have seen many patients and built this ability and skill, which allows them to maintain objectivity even while they are trying to dig into this person's deepest unconscious thoughts and desires. Um, they're trained to recognize transference. They're trained to know when the person they are analyzing is becoming more, is paying more attention to their relationship with the therapist than to their own uncovering of neuroses or whatever the case may be. And the analyst is constantly on the lookout for that and constantly directing the patient away from that type of situation. The analyst really wants to give the patient control over their own um, treatment. The the setting of the therapist's office is just a comfortable place for the patient to work out their own problems by talking, or in some cases um, which I think are quite beneficial. You know, some type of hypnosis possibly, or a consciousness altering substance will be administered, and this what that just allows is a quicker um, release of unconscious contents than just plain old talking. Talking therapy can take a while to be effective. It can take the therapist a while to really get the patient to open up to their unconscious. But under the influence of, say, psilocybin, if there is a trained therapist who understands how to lead people through these experiences, they can be quite transformative because the unconscious is just laid bare. And it's almost as though you're doing surgery on the psyche when you administer one of these substances. Um, the therapist is cutting open the scalp and peering into the brain, and the patient's inner spirit and inner struggle is just being poured out, and there it is before both the analyst and the patient to work with. It's out. Um, something like psilocybin really does that, and in a controlled environment, it can be very beneficial, I think. Um, but anyways, back to YouTube. I think this is a great place and a totally legitimate place to make psychological observations about each other. Um, it's a good place to observe yourself, and you can go back uh, months in the past and watch your prior videos, and I can I don't like to do it because it kind of makes me uncomfortable to see myself. Maybe I'll watch a video from 2 months ago and I won't agree at all with what I said in it, and that happens all the time. So it's awkward, but at the same time, I think it helps us to learn a lot about our personas, and YouTube as a psychological tool is something that we should explore further. I think there's a lot to be um, brought to the surface about how that process works and how we could better use it as a tool for some kind of development. Um, so I'd be curious to see what you thought about that.